Biggest Food Fight: Eating Disorders in the United States by Janine Hardery. What is an eating disorder? An eating disorder is an illness where different individuals experience severe disturbances in their eating behaviors, such as eating way too much or way too little. These individuals are preoccupied with food and only think of how much of what to eat in a day and how what they eat will affect how others view their bodies. There are three main types of eating disorders: anorexia nervosa, where the individual refuses to eat as much food as they should; bulimia nervosa, where the individual pukes or uses laxatives to get rid of their ingested food; and binge eating disorder, where the individual goes on purges and eats nonstop. Anorexia nervosa. Patients have an obsessional ideation of their own body image. The majority of patients are female, with only 5% of documented patients being male. This disorder can be diagnosed when the patient weighs less than 15% of the normal weight for their height and age. They often fast from eating or do strenuous exercise to attempt to not gain weight. Some symptoms are a lack of menstrual periods, mild anemia, which is a lack of iron in the bloodstream, and a decrease in internal body temperature, where the individual feels cold constantly. Bulimia nervosa. Patients consume their meal and immediately force themselves to vomit or take laxatives to get rid of it. They have a major fear of weight gain. These individuals eat an absurd amount of food in one sitting and then vomit or use laxatives to get rid of that said food. Some symptoms are tooth decay from stomach acid, intestinal problems from major use of laxatives, and severe dehydration. Binge eating disorder. Individuals go through major episodes of binge eating where they ingest a large amount of food in a very small time period and only stop when they are interrupted by others or fall asleep. This is the most common disorder, with 3% of the United States population diagnosed. It is also chronic, so it is extremely difficult for a diagnosed patient to treat this disorder. This disorder can cause multiple health issues such as obesity, diabetes, and multiple cardiovascular diseases. Social media. Many individuals often compare themselves to what they see posted all over the internet of skinny women or extremely buff men. This, however, can cause a distortion of self-body image, which often leads to eating disorders. There are multiple websites that advocate for unhealthy eating habits, such as pro-anorexia and pro-bulimia websites. There are also websites where you can take your own body measurements and compare them to models and skinny or buff individuals. Advertising. Many companies often show an attractive and thin female body, showing the product to possible customers. Few females truly meet this standard of having the perfect thin body. These advertising techniques cause a distorted self-image for those with eating disorders. One study showed that just 30 minutes of TV and advertising can alter a woman's perception of their own body shape and image. As body image itself is extremely unstable, and multiple social cues can alter it. Calorie labeling. Showing calories on the menu at a restaurant causes the total number of calories ordered by anorexia and bulimia sufferers to decrease, while there is an increase in the calories ordered by binge eaters comparative to a menu without calorie labeling. Body Project. The Body Project is the most widely used media literacy program. It teaches how to enhance resistant behaviors towards eating disorders, while hoping to make society more aware of the problems that many of its peers go through. They do this to attempt to prevent eating disorders and to spread positivity among young adults. Conclusion. There continues to be research done on the topic of eating disorders to this day. There are many programs who attempt to spread body positivity and help those affected by eating disorders. This disorder is slowly becoming more prevalent in society, and the number of patients continually rise every day. Reflection. Different types of eating disorders depend strictly on the individual person and how they view their body. Various health issues can be associated and connected to these disorders. There are multiple different reasons that one can develop an eating disorder. Social media tends to be the most prominent one. We're excited.